From my background, from where I came from, Steubenville High is a coal mine, steel mill town. Sports played a big role. Sports got me a football scholarship, only one, drafted by the Saints in the very last round. But I had to really work at it. And I think that work ethic in sports and in coaching has helped me develop as a person and use that same drive and determination in my spiritual life, in my family. That's where it came from.
Mr. Abramovich is a former NFL player, and he likes to work out really hard. He spends a lot of time in the gym, doing stuff on the treadmill, also with weights. And what he noticed at one point is that all of a sudden he started just losing energy to do all the things that he wanted to do in the gym. And also spending time with his grandkids as well. He was just getting more and more tired.
What I noticed was it affected me breathing. Like when I work out, I work out a lot. I try 5-6 times a week. And I noticed you can just tell. It's hard to explain that something's not right. The rhythm of the heart plus the breathing.
When he saw me in the clinic, what we diagnosed in him is a rhythm called atrial fibrillation, which is a fast heart rhythm that comes from the top chambers of the heart. And it causes the lower chambers to race, and then ultimately can present as weakness, fatigue, tiredness. The current recommendations by the guidelines of the Heart Rhythm Society is that we always try medications first. And that's exactly what we did with Mr. Abramovich. And he did well for several months, as most patients do. However, then ultimately he started having more atrial fibrillation, and at that point the recommendation that we made for him was to go on and have the ablation procedure.
He said, "What do you think?" He asked me. I said, "Well, if I were your dad, would you have him do that?" And without hesitation, he said, "Absolutely." I said, "Let's go with it." The reason I want to get something done with this is I'm around these grandkids, and I take them, my daughter leaves them, I got to take them to ball games and do this and this. I'm worried that something would happen to me when they were in the car with me.
Catheter ablation is a procedure that we know has been around for several years. And what that involves is putting in a catheter through one of the veins in the groin and going up to the heart. We position the ablation catheters in specific areas in the left atrium where the atrial fib comes from. And we burn those areas which are responsible for the atrial fibrillation. We're one of the busiest centers in the Chicagoland area, if not in the Midwest, to do these kinds of procedures.
Now that the procedure is taking place and I'm feeling so much better, I feel so much at ease now with my grandkids because they think I'm their playmate. When we go do these things, you know, "Papa, let's do this." They roll around, they want to tackle me. We have what we call Crossing the Goal Ministry, and we've established what I call spiritual workout groups. And that's why I think he's allowed me to continue on here. You're not getting away that easy, Danny. You got to stay down here. This is what I got for you. These grandkids and this ministry.
When he came to me and when we were able to help him out with both the medications and also the ablation procedure, and he has done well, and he has gone back to playing with his grandkids and taking them to Disneyland and Colorado for skiing, and you realize how happy he is with that outcome, it just makes you feel great as a doctor. It makes you want to come back to work and continue helping others.